In this video, we will delve into the topic of dangerous symptoms of low testosterone in men and analyze what can be done in such a situation. Testosterone is a steroid hormone with a powerful anabolic effect, that is, it activates the processes of formation and renewal of cells and tissues, especially muscle ones. Penetrating into the cell, testosterone interacts with the androgen receptor, forming a complex. This complex enters the cell nucleus and can directly or indirectly activate 146 genes necessary for the synthesis of various proteins. It is important to understand that the production of sex hormones decreases with age in all people. In men, testosterone is mainly produced by the testicles, and over the years their function also begins to deteriorate, although not as significantly as in the ovaries of women. Starting from the age of 30, the testosterone level in a man's body begins to decrease by about 1% per year. By the age of 50-60, testosterone deficiency is observed in 5% of men, at the age of 60-70 in 2 out of 10, and at the age of 70-80 in 3 out of 10. Testosterone levels in the body change throughout the day. Its peak is at 8 a.m., gradually decreasing by 8 p.m. and rising again at night. The younger the man, the more pronounced the peaks of testosterone. For example, for a man in his prime, about 40 years old, the difference between morning and evening indicators can reach 200 units. Now let's move on to the most noticeable symptoms of a dangerous drop in testosterone. One of the most obvious consequences of a decrease in testosterone is a decrease in libido. A man may experience avoidance of sexual intercourse or a marked drop in desire, even at the thought of intimacy. In this case, a man may feel tired, dissatisfied and eager to do urgent things. Another important symptom is a worsening erection. If a man with low testosterone levels still decides to have intimacy, he may face difficulties in achieving an erection and maintaining it during intercourse. Testosterone activates the production of nitric oxide, which triggers a series of biochemical reactions that lead to a decrease in the concentration of calcium in smooth muscle cells. This leads to muscle relaxation of the cavernous bodies of the penis, and filling them with blood, which is expressed in an erection. Weak erection, decreased sperm volume and quality, chronic fatigue, depression, decreased concentration, all this can be a sign of a dangerous drop in testosterone levels in the male body. You should not try to restore an erection with hormones on your own, since the chain of reactions leading to it includes several links, any of which may fail due to a wide range of pathological conditions. Testosterone deficiency is just one of the possible causes. Men involved in sports also complain about a drop in motivation for training and the femininity of the figure. The balance between male testosterone and female estrogens, sex hormones, determine the development of sexual characteristics even before a person is born, and the specific characteristics of the body in its adult state. If testosterone becomes too low, then the proportion of estrogens increases, which affects the formation of fat deposits, in the worst case, leading to obesity, diabetes, etc. The figure of a man with low testosterone can acquire rounded, more feminine outlines. Sometimes gynecomastia develops, enlargement of the mammary glands. There is an opinion that testosterone provides an increase in muscle mass in people involved in sports, but studies show that testosterone does not cause significant muscle growth within the normal range. The muscles of athletes who do not take anabolic steroids, exogenous testosterone, grow due to adaptation to stress with sufficient intake of protein from the testosterone for muscle growth begins to work only after exceeding the norm by 20-30%, which, in addition to a large mass, will give a lot of negative consequences, for example, hair loss. Hair loss is one of the most common symptoms of low testosterone levels. Although male pattern baldness is also associated with many other factors and genetics. Studies confirm that testosterone plays an important role in hair growth. Therefore, maintaining normal testosterone also means taking care of your hair. The level of testosterone in a man's body is indicated by the degree of his baldness. One of the forms of testosterone, dehydrotestosterone, really worsens the blood supply to the hair follicles in some representatives of the stronger sex, as a result of which the follicles may begin to degrade and the hair gradually turns into fluff instead of full-fledged hair. Other places of hair growth do not suffer at the same time. Hypersensitivity to dehydrotestosterone is peculiar only to the follicles on the head of men and not all, but only those genetically predisposed to it. Therefore, firstly, a bald head and a full beard with thick chest hair are a normal combination, and secondly, the owner of thick hair may have the same testosterone level as a bald person. Frequent fractures are another sign of low testosterone levels. Sex hormones in men play an important role in the balance of bone formation and destruction. A decrease in testosterone, especially in older men, makes their bones brittle and increases the likelihood of fractures. Reducing the size of the testicles is another possible reason. Testicular atrophy is a serious disease that requires professional medical care. Hormonal failure in an adult male, developing against the background of obesity, is often associated with the production of testosterone. The smaller the volume of the testicles, the less they are able to produce their own testosterone, which further aggravates the situation. By the way, the same process can develop against the background of taking steroid anabolics. Unlike women, who have a sharp drop in the level of female sex hormones for several years, men move to the stage of testosterone deficiency very slowly. Sudden mood swings are a familiar phenomenon for many. The world sometimes appears as a paradise on earth, then it is shrouded in an impenetrable fog of hopelessness, which, it seems, can be cut with a knife. Where does this emotional carousel come from? The answer may lie in a lack of testosterone. Testosterone is a hormone that plays a key role in the formation of a male personality, affecting physical characteristics, sexuality and, importantly, emotional state. Its deficiency can manifest itself not only in a decrease in libido and fatigue, but also in increased irritability, depression, and mood instability. If you notice similar symptoms, you should consult an endocrinologist. A specialist will diagnose and prescribe appropriate treatment that will help restore the balance of hormones and restore your mental balance. The above signs are a manifestation of a lack of testosterone, which the body can no longer ignore. Therefore, when they appear, you should consult a doctor and find out what can be done to restore normal testosterone levels on your own, and what requires treatment only with hormone replacement therapy. Thank you for watching this video to the end. If it was interesting, please like and subscribe to the channel. There will be a lot more useful information later. See you soon.